please make your way to your seats. So my name is Andrew Jack from the Financial Times. It's a great pleasure to moderate our event, which has two parts this afternoon after some initial reflections. And we're talking here about sexual and reproductive health and rights at work, the new frontier for ESG. So we're going to be hearing from a number of public and private sector organizations partnering here together. We were having a discussion before, and I was asked why my interest in this. I mean, to me, reproductive health, it's a human rights issue. It's a fundamental health issue, of course, with a tragically large number of completely preventable deaths. And it's also, of course, an economic issue and an opportunity for business to come together, public and private and non-profit, and to add more overall. And that's very much going to be the theme that we're discussing this afternoon. Just a word on logistics. I should say also that this is co-hosted today by the Coalition for Reproductive Justice in Business, jointly between UNFPA and Ferring Pharmaceuticals. We're going to largely focus on the interventions from our panelists, but also hopefully we'll have a little bit of time for questions both from you here and also people who might be watching remotely. There's a bit of technology called Pigeonhole Live, which allows you to ask questions and indeed to upvote questions, so we can try and get a sense of what the key hot issues are that you might want to raise. And so if you go to pigeonhole.at and then the event password, which is SRHRWF 2024. It's not on the screen, but hopefully you can remember. Or there's a QR code, which I think is somewhere, which you can also use. So with that, let me turn to our first speaker, Maria Rosa Cutillo, who's Chief Strategic Partnerships Branch at UNFPA, to give us a little bit of a tee-up of why we're here today.
And thank you. I'll be very brief. I'm Italian, but I'll try to be brief. And just to welcome you. We're very happy to be here today. We're happy to finally share the progress we achieved after 1 year. Last year, during Davos, we launched the Coalition on Reproductive Justice in Business, and many of the members are here today. It's a platform, multi-stakeholder platform, public, private. What we wanted to achieve in 1 year was to develop indicators to measure how the private sector can promote sexual and reproductive rights in the workplace. So it's been a journey this year, an exciting journey with the coalition, and thank you again, but also with Accenture, and so we look forward to hearing about the indicators. I won't say much, but I'll just thank everyone, the speakers and all of you for being here today, and I'll leave the floor to Andrew to introduce the first panel. Thank you, Andrew.
Great, thanks. And actually, before our first panel, we're going to hear just a few words also from Natalia Kanem, who's the Executive Director of UNFPA.
Thank you, Andrew. Greetings, Excellencies, distinguished speakers, guests. We're so happy that you're here. And I'm welcoming you to an event which is so aptly titled. It's a coalition for reproductive justice in business. This initiative, spearheaded by UNFPA, which is the United Nations Sexual and Reproductive Health Agency, along with our partners, and I'd like to name today in particular the partnership that we have with friends at Ferring Pharmaceuticals. The discussion that we're having is part of an understanding of sexual and reproductive health and rights at work, which is where women, men, everyone spend a significant amount of their time. Part of the reason Forbes has called this the new frontier for environmental, social, and governance ESG reporting. Today, we will have the opportunity to talk about why. And I think it's been inspiring to be part of a movement that insists on dignity for women, for adolescent girls, for people in general. And many of the work that our partners in the C-suites around the world are doing make a real difference for employees, for shareholders, and for investors, along with customers who are tuned in to this issue. We are raising the alarm about women's health in the workplace because Nearly 200 million women work in global supply chains, concentrated in countries where women's needs for health services often go largely unmet. And these women workers' needs for health care, for protection from harassment and violence, and for fair wages are not always top priority, and they need to be. Who has the power to change this? It is business, respected, part of a community that can push the needle forward on women's reproductive health and rights, on gender equality and women's economic empowerment, and as companies reflect on their corporate social responsibilities, improving the health of women and girls should be a top priority. When companies do adopt family-friendly policies, and what do I mean by this? And we've been studying this, and I think it's going to be exciting to hear a little bit of the detail. Flexible working arrangements. A woman can cope with menstruation or menopause, normal natural biology, often subverted, shamed, and not given the priority. Family planning programs, contraception, convenient to the workplace. Subsidized access to reproductive health services, big discussions right now around fertility, for example. And support, psychological support and health support to women who can be victimized by violence, by harassment. When you have some of these friendly policies in place, yes, it makes women employees a lot happier and healthier, but it also makes people empowered to make autonomous decisions in their personal and professional lives, and that's what increases their economic participation and their social benefit. For us at UNFPA, it is a privilege to partner with business. It's actually been a great learning experience with business as key allies. We've thought through, what does diversity really mean? What will equitable and inclusive workplaces look like? We do have to imagine that future as we march towards the Summit of the Future at the United Nations at the end of this year. When women realize their sexual and reproductive health and rights, as it turns out, the good news is businesses indeed benefit overwhelmingly. More skilled, more productive, more engaged workforce. Now, the business case is there in theory and documented by data, but right now many businesses continue to actively disadvantage women. Let's give a nod to things like parental leave policies, which are improving, but what about effective policies where people are not asking for special dispensation when it comes to some of these issues I mentioned, like menstrual health or menopause or re-entry programs to help women who want to return to the workforce after an absence, maybe for childbearing and child rearing. For violence prevention programs, I'm not sure that this is top of line in discussions around businesses today, but it has to be, because women are reticent to come forward if the norm and standard isn't set. So I will say that it's your brain power, it's your influence, it's your ability to have a financial impact on a woman's life that's going to transform her reality. With UN Global Compact, with the United Nations Foundation, with the Global Reporting Initiative, GRI, with Philips, ODI, Gender Fair, the Leitner Center, the Global Fairness Initiative, and so many others, we have now established this coalition for reproductive justice in business. And the aim has to be to have companies step forward, men in particular, understanding that gender is not just the ladies, it's really everyone. And in fact, to mainstream women's economic empowerment in every company's day-to-day activities. That's going to take championship, it's going to take energy, and spreading the word, because, being passive about this has not worked. So with respect to accountability, the excitement for me is to see that Accenture has been a fantastic partner in looking at the data and developing metrics. You'll hear something about this. And with a rising interest in sustainability, reporting. There's a large focus on the E in ESG, right? And now we're saying the S has to get some equal time around here. And the particular focus on the impact on women is apt. As businesses encourage employees to bring their entire selves to work, businesses cannot ignore the workers' identities as reproductive and sexual beings. It just so happens that your productive years at the workplace are also your reproductive biological years, and for that overlap, reproductive rights can't be an afterthought. That is key to dismantling some of the barriers that we see creating workplaces that welcome diversity and actively support it. So on behalf of UNFPA, we proudly stand here ready to work with you to move the private sector forward, hopefully faster. That prosperous future is something that's going to unite us, young people and older people, a world that is now demographically diverse and thirsty for answers. How are we going to be able to create workplaces where people thrive and flourish, and where partnership has meaning for every human being on the planet? Thank you for being here. We really appreciate your presence.
Thanks, Natalia. A very helpful framing. And now we're going to hear some particular examples and perspectives. So if I could ask, please, our first panel of 5 to join me on the stage here. So we have Sahil Tesfu, Chief Strategy Officer at Essity, Kelly Clements, Deputy High Commissioner for the UNHCR, Angus Rennie, Head of Partnerships for the UN Global Compact, Shannon Cohn, Executive Producer of Below the Belt, and Lorenzo Bertelli, Executive Director of Prada. So a reminder, we're talking here about the role of the private sector in advancing women's health and well-being. Fairly small amount of time, so I'd ask you all please to be brief. But let me turn first of all to Sahil, and let's hear a little bit more about the stigma surrounding women's health and well-being and how to effectively address it in the workplace.
Yes, very happy to speak to that. So Essity is a hygiene and health company. Our purpose is to break barriers to well-being, and we truly believe that hygiene and health are at the essence of well-being for both individuals and societies. So when we talk about women's health, particularly we talk a lot about menstrual health and incontinence because that's the business that we're in. So I will focus my answers a bit talking about menstrual health here. So let's keep in mind that 1.8 billion people every month menstruate. Okay? But a lot of them actually are not able to manage their menstruation in a healthy and in a dignified way. And this is not a problem of the third world. This is not a problem of emerging markets. This is a global issue, and it's an issue that we care very deeply about. And of course, this topic is surrounded by a lot of stigma. And the stigma is not just at the workplace. The stigma starts when you have your first menstruation, you're a young girl, hopefully you're going to school, which is also not a reality for everyone. But if you do, you might miss school, you might not have access to clean sanitation facilities, clean water. You might be surrounded by stigma. Those who care for you don't understand what is happening. Once you enter the workforce, if you're lucky enough to do so as a woman anywhere in the world, you will be not probably able to manage your menstruation again in a healthy and dignified way. So this is a lifetime problem when it comes to menstruation. And stigma is one aspect of this. There's a lot of other aspects, like do you have access to safe and affordable period products? Do you live in a stigma-free environment? Do you have the information and the education to manage your menstruation? So this is really a very broad problem. Then of course we have to address this stigma, and let me again highlight that this is a global problem. There's research we have done that was done to look at people working in Sweden, research in Sweden, again a country that is perceived to be leading edge when it comes to gender equality. Some shocking numbers from this research. 55% of the women between 18 and 55 do not feel 100% comfortable to speak about menstruation at the workplace. Again, this is Sweden. Roughly 10% have witnessed discrimination at the workplace related to menstruation. And finally, 25% think that their workplace is not doing enough when it comes to menstrual health. So this, of course, is a huge, huge problem. So we need inclusive policies, we need inclusive policies that bridge these menstrual health gaps, and these policies need to be holistic. At Essity, we actually approach this topic in 3 areas. The physical work environment. So do you have access to clean, do you have access, first of all, to the products? Do you have access to clean sanitation facilities? Do you have access to clean water? And again, we're talking about employees, not just in the fancy offices, also in the production sites that we have all over the world, because sometimes also a topic that is a bit forgotten in the discussion about the workplace. We also talk about work culture. How can you break down stigmas in the work culture? How can you sensitize not just managers but employees overall, not just those who menstruate but also those who don't, in order to create that culture at the workplace that is stigma-free. And thirdly, also employee benefits can play a role here. And as again, here we look into different areas. We look into how can we create flexible work arrangements. Again, not something you ask for, but something that is offered to you in global policies. And yes, the solution sometimes looks different in different countries, but you can still have a global ambition. In addition to that, also other benefits we can offer is health consultations, free access to health consultations. We can offer as well mental health support to our employees. So these are the 3 areas: physical work environment, the culture, and also the benefits that we think are necessary to look into, to have a holistic approach to break not just down the stigma, but to create a dignified environment to menstruate, not just privately, but also when you work.
Okay, thanks. So, Kelly, UNHCR, you deal with refugees, displaced communities, and so on. I mean, give us a sense of the vulnerabilities, particularly of refugee women, and maybe what the scope is for working with employers and the workforce to tackle them.
Yeah, thank you, and thanks a lot to UNFPA, and I'm glad to be on this great panel to talk about a very important set of issues. Yeah, so I'll bring this back to 114 million people that are forced to flee from their homes, 35 million refugees, a majority of the remainder those that are displaced within their communities. As they're leaving, there are risks, there are dangers. Many, unfortunately, suffer sexual violence en route to try to find a safe place for them to be. Some have suffered that sexual violence in their own homes, which has forced them to flee. So you can imagine, in terms of when people are leaving these particular contexts, what is it that we then, as communities that may be receiving them, or countries that may be receiving them in the case of refugees, need to be thinking about overall in terms of what kind of care, how to think about the vulnerabilities perhaps they've come from, but what they need in order to get back up on their feet, have take care of their health, take care of their families, take care of themselves, and in many cases go to work to be able to support those families. So there's a whole range of issues. You can see obviously then the vulnerabilities, but then you also then see the opportunities. And a couple of opportunities here is when we don't necessarily treat those displaced or those refugees as different from the citizens of a particular community, and when they are included in the care that may be provided to the citizens of that community or of that country, they are able to benefit then from a broader range of services. In this case, obviously, we're talking about health and a comprehensive health. Reproductive health, yes, but also other healthcare services, including mental health. And that becomes fundamental in order for that kind of recovery process to happen. And then for those individuals, those women, and when I mention the 114 million, the majority are women and girls. So whether they are girls of reproductive age or women who obviously want to enjoy the opportunity to be able to work. And the couple of big drawbacks that they find in some of these areas are childcare, information about services that may be available in their new communities, and that includes healthcare services and where they might go. And we see good examples, and I want to come back because this is almost the 2-year anniversary of the start of the war in Ukraine. The decision that the European Union took to extend a protection mechanism to include families and women, and we know in this case we were talking upwards above 80% of those refugees refugees that were leaving Ukraine, and the majority of the displaced being women and children. And this, looking at this from the context of who it is that are being assisted, having those families then included in services in their host countries or home communities within Ukraine, to include a comprehensive set of health services, then allows, of course, those individuals that have been forced to flee for horrific reasons to be able to get back up on their feet more quickly, to be able to take care of themselves and their families. So we think about care and protection and aid in a very comprehensive way to include sexual and reproductive health.
Thanks very much. So Angus, the UN Global Compact, you work with private sector companies mobilizing them around sustainability. What do you see? What's the scope here and how to accelerate that private sector commitment around sexual and reproductive health?
Yeah, thanks. First, let me just say how proud we are to be a partner of UNFPA for this really important work. It's so complementary to what we do, which is a general call to companies around the world to align their business practices with the SDGs and the values of the UN and the 10 principles of the Global Compact. So I might answer a question with a question. Imagine what this conversation today would be like if we had equal representation among women and men in the workforce, in particular in management. Just imagine. I think, we hear that the S in ESG is somehow, harder to wrap our heads around. I don't think it's that complicated. And I think that if we had equal representation in the boardroom, in the workforce, we might find that we realize how simple, really truly simple it is. Imagine how the conversation would shift if we had equal pay for equal work, and we valued the work of women as much as we did men. Again, I think this S and the SR in S would not be complicated, and it would also enable companies to thrive and to achieve more and to be more profitable than they are now. And so I think that's the angle that we come at this as the UN Global Compact. When we hit the halfway mark of the SDGs and we realized sort of the sobering reality that we were really off track almost across the board, that we needed to call on companies to move forward faster. But we needed to boil that down and simplify that. And we identified 5 key areas where we feel that the private sector is uniquely equipped, if they really put their energy behind the goals, to unlock progress and get us to 2030. One of those is on gender equality, and I'll just share the two targets because I think they really are an important sort of foundation for then the metrics that the coalition is trying to put forward. Equal representation, participation, and leadership of women across all areas of management by 2030. Asking companies to commit to that, and to commit to equal pay for work of equal value by 2030, and to report on that through the Global Compact's Communication on Progress, our annual reporting requirement that we ask of companies. And I think that if we emphasize that in parallel to the work of the coalition, we're going to be helping ensure that the decision makers around the table are those who recognize that this is common sense, it's good business sense, and it's truly going to transform the lives of women and men around the world for the better.
Thanks very much. So let's move to the creative world. Shannon, the power of storytelling. What scope from your experiences do you think could be having in mobilizing the private sector around these issues?
Sure. Thank you, and thank you for having me here, and thank you to all of my esteemed panelists for your important points of view. Okay, so now we'll do the interactive portion of the evening. How many of you have been moved to tears by a story you've heard or seen, read? How many have laughed aloud? How many in the same story have laughed and cried? All right, and that's the best kind of story, kind of, isn't it? How many of you have been compelled to act in some way, whether it's Google searching something you've just read about or heard about, anything, taken any action? That's the power of storytelling, okay? So I'm done. No.
One more minute.
Okay, fine. I'll go a bit further. We as humans, we love stories. That's how we relate to one another. That's how we relate to being on the planet. Facts, statistics, they give us information, vital information. Stories give us meaning and give the emotion to the statistics and the facts. So it's a one-two punch, so to speak. And it's important, well, I'll give you some anecdotes first for where I'm coming from. For example, in Uganda with gender-based violence, they were really struggling a lot of getting spouses or partners or anyone who's a victim of gender-based violence to report it. And tried different initiatives, public policy, all of these different things. And what they did is they made a film. And they showed it in over 600 screenings in over 112 villages across Uganda. And over 10,000 adults saw it. And research shows there was a marked increase in individual reporting of gender-based violence. Rwanda, there was a radio program that profiled how two villages turned against one another and, acted violently toward one another, but then told the story of how the two villages reconciled. And it actually sparked a national reconciliation movement, which you may know about. That's the power of storytelling. And then I've used it in my work. I'm an attorney, a social impact strategist, and a documentary filmmaker. And yes, all of those hats come together in a really interesting way. I have worked with refugees. I've worked in international M&A. I've worked in all of these different things. And I wanted to find a way, because so many times institutions that we have are kind of stagnant. Health institutions, all of these, that we all work within. We want to see the change. But the problem is if we have to operate within the system that's not working, then you're just kind of banging your head against the wall. So creatively, we find an end run around that so that we can find creative ways to create the change that we want to see. One last note on that. And the main thing in storytelling that we try to do is not only share the lived experience of an individual or a group of individuals, but that individual, of course, needs to be rooted in fact and rooted in data, but it also reflects a larger public health issue. And by that reflection, we are compelled to move forward, and to move forward in a meaningful way, because we've set those goals and we know where we want to go. For example, my last film, Below the Belt, which is exec produced by amazing partners like Hillary Rodham Clinton and Rosario Dawson, to name a couple, we have partnered in meaningful ways. Elizabeth Warren, who's a Democrat in the U.S., and Mitt Romney, who's a Republican in the U.S., co-hosted a screening of this film on Capitol Hill for congressional members. It was really revolutionary to see two people on diametrically different sides of the political spectrum showing on Capitol Hill a film about women's health. We work with the White House Gender Policy Council. We just last month screened the film for 20,000 plus members of the NIH across all of the 27 institutes. There's so many, we're doing a medical school screening tour. We screened at 15 medical schools. I taught a class in bioethics at Harvard Medical School last year where we showed the film and we looked at all of these larger issues that the film presents within women's health: the menstrual taboo and stigma, gender bias in medicine, racial bias in medicine. What does it mean with profit-driven healthcare, and how can we all work together? And lastly, barriers to care, institutional financial barriers to care that we all grapple with. All of this was done by a story that followed four people in their lives and their lived experience. So that is the power of storytelling. It's just harnessing it and using it as a force for good in the world. So not only changing hearts and minds, but changing policy.
Okay, so Lorenzo at Prada, tell us a story, short, but about your journey around DEI and what it's doing within the company.
Thank you, everybody. Thank you, UNFPA, for the invitation. I'm going to tell you my stories, and as you said, you can think about that Prada doesn't matter with this topic, so we will get there. So first of all, I want to tell you stories about what we are doing with FPA. And we're doing what we usually do best in Italy, for example. So we're working in Kenya, in Ghana. We already done it to educate and also forming women that for different reasons are in a fragile situation, so sexual harassment, abuse, how to tailor product, and because there are plenty of production made in those countries, and so we give them an hope for the future. And this is the most important things. But the real reason why we do that is not just because it's morally right, and this is, should be enough for everybody, but the main reason is because we are a company made of 63% of women. We are successful, luckily. And so it's very important for our company to have a good governance and to have the best working environment possible, to make sure that everybody understands the needs of every gender, and especially women in our case, of course. And this is so important because all the executive men's, especially men's, has to understand the needs that women have, because me personally always say that I work better with women than men. I mean, first of all, there are less egos, much more resilient, and they have more sensibility. So there are so many reasons why women environment in like ours are much better than men's, and I will see that the success of our company proves. But to really being able to make them comfortable and also to be competitive in attracting new talent, we need to understand which are their needs. And so we need for sure at least to give a general knowledge of their issue and or their problem, everyday problem, and to really try to accommodate them and make them happy in their job environment. So this is for us is a tool to have also content and stories to be told to our population, to our executive of what is the life about for them, you know. And so this is part of our overall strategy, and I can really say that I mean I just recently became a father, and I would say that if you look at them, I mean I'm so proud. I would say they're like lions and heroes when they have to grow childs and so on, you know, by themselves, keep smiling in with sleep deprivation and so on, you know. So I think like they are naturally forged, you know, and so then at the end they're more resilient at work. So I really want to spread this message and make people understand that this is just an opportunity, it's not a problem. So this is very important to be said.
Okay, so we're a bit short of time, but let me then just ask each of you one sentence on what your message would be to companies, what they could do, what would be most important to really drive women's empowerment. Maybe start with Rosa and move back this way.
I think I already say so. I mean, one word is an opportunity. So first of all, this is, I think, is the most important thing. It's not an issue to be solved. It's an opportunity, really.
I would just repeat what I said: is focus on changing hearts and minds, and the rest will follow.
Okay.
Equal representation in management and equal pay for equal work are the foundations for sexual health and reproductive rights really flourishing in the workplace.
Building on opportunity, think about the whole person and what they're bringing to the workplace, and that can be an opportunity for the business.
For businesses, particularly when it comes to menstrual health, think big but start small. It's not that complicated.
Perfect. So great, I'm afraid we're out of time, but great panel, thank you very much. Do please thank them again, and we're going to now show a very short video before moving to our second section.
Kadına şiddet konusunda evet Türkiye'de genellikle ayıplanıyordu. Hani kadınlar susturuluyordu ama ben bu iş yerine girdiğimde hani bunun böyle olmadığını aslında herkese her şeyi anlatabildiğimi anladım ve buraya geldiğimde daha çok açıldım, daha çok özgürleştim.
Salah satunya mereka mendapatkan pelayanan kesehatan pertama untuk ibu hamil, dapat pemeriksaan ibu hamil, yang kedua juga bisa KB juga. Selebihnya juga memang mereka sering konsul sama saya tentang kesehatan reproduksi. Kita tahu reproduksi perempuan kayak gimana, jadi bisa ngedukasi ke teman-teman juga, ke keluarga juga.
Of existing partnerships with UNFPA in Indonesia and in Turkey. And so we've been talking about business metrics, driving performance, focus. And so I'm going to ask now, in this beginning of the second part, Natasha Sundarji, Global Health Lead for Accenture, to talk a little bit about the journey in the private sector and what can be done.
Fantastic. Thank you so much. So first and foremost, our speakers and our panelists have done a fantastic job highlighting some of the ways in which the private sector can address the diverse reproductive health needs of their employees. But to assist private sector actors in their journey, Towards sexual and reproductive health improvements, UNFPA and Accenture have come together to co-create a set of practical and actionable tools that we are introducing to the sector today. Our hope is that these tools will enable businesses to not only track their progress, but share their successes and hopefully create greater accountability through ESG reporting. So to better understand why these tools were created and how they can support the private sector, I'll start by reinforcing some of the benefits of investing in sexual and reproductive health. Secondly, highlight some of the current investments we're seeing across the private sector and where there are significant gaps. And then finally, introduce this guide that can help to support the private sector in their journey towards improving sexual and reproductive health for their workforce. So first and foremost, there are very clear and measurable benefits to both employees and companies by investing in sexual and reproductive health. You heard some of our panelists talk about this. The tangible benefits include increased productivity through decreased absenteeism, enhanced employee morale, improved retention, and recruitment. UNFPA has done multiple studies on this, and according to some of those studies, reproductive rights at the workforce can result in up to a 22% increase in productivity and up to a 62% reduction in absenteeism. Also, investing in sexual and reproductive health can also reduce your costs. Incorporating reproductive rights in the workplace can result in up to a 23% reduction in talent attrition, and we all know the war on talent within the private sector. So not only are there these direct measurable benefits, I think many of us in the room are very familiar with some of the more intangible benefits that are a little bit more difficult to quantify, but very much exist. Those include improved employee engagement and motivation, company brand differentiation and value, leading to consumer attraction and retention, improved talent attraction and retention, especially amongst women and young people, and of course, reduced legal, reputational, and operational risks. Yet, despite these very clear benefits, we see SRHR activities in the private sector vary dramatically across different types of organizations. So we as Accenture spent significant time reaching out to multiple different types of private sector companies across industries, across regions, engaged with various SRHR experts and other contributors to really understand what is the current state of sexual and reproductive health policies and initiatives. Now, we define maturity when it comes to these efforts across 3 different lenses. 1, are strong policies in place to address the SRHR needs of their employees? 2, do they have robust awareness efforts to improve visibility of those SRHR policies? And last but not least, do they then invest in improving access to sexual and reproductive health products and services? Now, on the policy front, while gender-based violence and parental care policies tend to be well established across multiple private sector actors, activities around other SRHR policies are not prevalent. That being said, there are certainly exemplars to point out here. Nestle, for example, is doing a great job on the policy front, particularly in creating global gender-neutral parental support policies, which provide paid leave for primary and secondary caregivers. They also provide pre- and post-maternity benefits, which include things like ergonomic seating, priority parking, special travel entitlements for mothers, for children, for caregivers. What's been really interesting is that government action has also helped to drive some of the improvements we're seeing in policies across the private sector. Menstrual leave policies, for example, are active now in 7 different countries, with bills in parliaments in 5 other countries. This kind of legislation and that government partnership is going to be critical to encouraging the improvements we're looking to see across the private sector. On the awareness front, while there are certain awareness building activities through training, through surveys, external summits, blogs, we're not seeing awareness happening at a global scale across the private sector. While there are certainly leaders, again, who have stepped to the forefront to advocate for and to drive awareness, leadership commitment and action on SRHR is generally minimal across the sector overall. Again, outstanding examples to call attention to, the exceptions, the actions of Marks & Spencer's, the British multinational retailer. Marks & Spencer's has created a menopause network and training program in collaboration with experts to raise awareness around and normalize conversations around menopause between their managers and employees. In addition, they've created really effective awareness campaigns and early detection campaigns for breast cancer through a partnership with Breast Cancer Now. Together, they designed and rolled out breast cancer signage in over 1,500 plus fitting rooms. Last but not least, let's talk about access. So access to counseling and services on SRHR, which can be performed directly at a company facility or via government or other private sector actors, is generally limited. Now, there are notable efforts to increase access to primary health care, but primary health care tends to exclude sexual and reproductive health, even though it's a very important and integrated part of it. Here are some of the examples of the exemplars coming to the forefront include Cargill, who offers breastfeeding rooms on site. Mass Holdings offers on-site and off-site childcare services. Marks & Spencer's, again, offers free sanitary products and provision of menopause-friendly uniforms at all of their sites. Prada, who you heard from in the first panel, offers cancer screening and prevention services. And Faring, Organon, and many others are starting to provide infertility treatment coverages. Now, in each of these companies, leaders identified the critical sexual and reproductive health needs of their employees and took actions to address them through the creation of policies, through awareness initiatives, as well as various access programs. But when we spoke to these same leaders about measuring their progress, they all expressed the same challenges. To date, sexual and reproductive health measurement is not aligned to any ESG standard. So while there are some metrics that are in place, like the number or percentage of employees that are entitled to take parental leave, most sexual and reproductive health needs, actions aren't standardized in metrics, and they don't find their way into ESG reporting. And since companies don't necessarily know what to report on, they either don't report or activities vary quite a bit. And people don't know then what to manage. From a governance perspective, most sexual and reproductive health activities are driven by the HR function, or they're spread across HR, inclusion and diversity, sustainability, procurement, compliance. Because of that, it becomes really difficult to find an accountable body for sexual and reproductive health within an organization, which creates challenges when it comes to sustained investment and measurement. So in light of that, what do we do? In light of the gaps we're seeing around policy, awareness, and access, we've designed a framework that helps to bring together needs and the opportunity areas that need to be addressed by the private sector. These come into these 6 sexual and reproductive health focus areas that we want you to focus on today, and are summarized on the handout that you received just before this. So the first is detection and prevention of sexual and gender-based violence. The second, antenatal, childbirth, and postnatal care. The third, prevention and treatment of HIV/AIDS and other STIs. The fourth, counseling and services for women's reproductive health and menstrual health. The fifth, counseling and services for modern contraceptives and comprehensive family planning. And last but not least, detection, prevention, and management of reproductive cancers. Now, the first step in any private sector actor's journey towards SRHR improvement should be an assessment of your current state of maturity across these 6 focus areas. And to guide you in your maturity assessment, what we've done is created a set of questions for SRHR self-assessment. What we've also done is compiled references to other tools that can help you in this assessment. The next piece is designing tangible SRHR policies, awareness campaigns, and access initiatives, complemented by clear metrics that allow you to measure your impact and change over time. Here, UNFPA and Accenture have compiled a list of SRHR case studies highlighting private sector best practices across industries. These case studies include the context for why these companies took action, a description of what they actually did, the obstacles and pitfalls they faced, and key lessons learned through this, as well as the outcomes and achievements to date. In addition to this asset, we've created a starting list of 30+ indicators and metrics under those 6 focus areas that can help companies to measure the ROI of their investments and encourage ongoing investment and scale. Lastly, what we've developed is guiding principles to support the private sector in the rollout of initiatives. This includes how you create that common language around SRHR in the workplace, and how to remove stigma and make SRHR the norm. So the third step in your journey has to be embedding SRHR in ESG reporting. So integrating SRHR initiatives and metrics into ESG reporting gives you the opportunity to showcase your commitment. It gives you the opportunity to demonstrate the positive impact that you're having and share your learnings with others. To support companies with these steps, Accenture and UNFPA have created an approach to integrate SRHR metrics into the ESG reporting, a guide that can help you to optimize the way you do that integration. Last but not least, I want to talk about maturity. So everyone is starting at a different level of maturity. And over time, our goal is to be able to see private sector companies advance in their maturity, to do more. So we encourage you all to maintain a proactive approach by regularly assessing your progress and continuously striving to improve across all 6 SRHR focus areas. So on behalf of Accenture, as well as the UNFPA team, we're so excited to be here with you today to launch these tools to help the private sector advance their SRHR efforts at scale and pace. And I would encourage us all to use this moment today to work together. Let's seize this moment. Let's harness our collective experience and make transformative impact on the lives of millions of girls and women today. Thank you.
Thanks, Natasha. So it's a really useful insight in a set of metrics, both for internal, driving internal change, but also consistent tracking between companies to align with ESG reporting. So we're now going to move to our next panel to discuss some of those issues, acceleration into next steps. So could I please ask Per Falk, the President of Ferring Pharmaceuticals, Rupa Dutt, the Women in Global Health Director and co-founder, Jan Wilhelm Scheengrond, the Vice President for Government and Public Affairs at Royal Philips, Peter Paul van der Vis, Chief External Affairs Officer from the Global Reporting Initiative, and Marin Wiersma, Director of Community Innovation at 2X Global. Thanks very much, everyone. So we're talking about kind of next steps, acceleration. Per, let's talk a little bit, if we can, please, about Ferring and where you are in the journey and how these sorts of metrics could be useful for next stages.
Well, first of all, I think it's a great initiative because what gets measured gets done, as it's popularly said, at least if it has consequences not to do it. So you need to link it to some consequence, and ESG reporting, which from this year is law in Switzerland, for instance, will definitely help drive behaviors. Right? So Ferring is a reproductive medicine company. We do a lot of things, but this is at the core of what we do. So our work is about helping people to get pregnant, to be pregnant, and to deliver healthy children. And we do a lot of initiatives around this, among others with the UNFPA when it comes to advocacy and also programs to deliver therapies to people worldwide where it's badly needed. But we also felt that we need to do something at home. So as a reproductive medicine company, we should take sexual and reproductive health rights serious and walk the talk. So we have launched something we call Building Families at Ferring. And it really builds on our global credo, building families of all shapes and sizes. So we implemented a program a couple of years ago where we, first of all, help all our employees who aspire to have a child but cannot. That's about 1 couple in 6. And then there is a number of same-sex couples as well who needs technology to become pregnant or help with adoption. So we provide the support services and full funding for all assisted reproductive technologies for our employees. We also support full with adoption services and with surrogacy. And once there is a pregnancy, we give our employees, whether it is the birthing or non-birthing parent, we give them 6 months of fully paid parental leave, where they can be away from the office or from the factory and then come back again after 6 months. And this has been extremely rewarding for us. There is a significant cost for a mid-sized company to this, but the upsides far outweighs that. And you know, there's so many. I can mention a small one, which actually we don't think about that much. We thought that one of the biggest cost drivers for this would be that we would rehire people to backfill the 6 months leave of absence. Actually, that doesn't happen. We have started a very good virtuous cycle of job rotations, where someone moving out of a job enabling someone else to move in and try that job for a period of time. So we actually get much more mobility within the workplace and allows people to try other careers. So there's many secondary benefits to this, including the primary one. We help our employees managing the transition into family life, which is a very big one. That happens at a time when also your career is accelerating, and there is usually a clash, and you make a decision. And the people who makes that decision is usually women who will have to make the compromise. It doesn't have to be that way, but it is that way. So we are also trying to help our employees to see that there is a way of combining, family with work and do well in both.
Thank you. And of course, we haven't talked about what we can come back to, perhaps also your actual products, which of course make a huge difference in lower income countries, amongst others, in reproductive health. But Rupert, let's talk a little bit about civil society and what role you think that can play in mobilizing around the field.
Yeah, definitely. But I just want to acknowledge what your company's doing. I don't get that as a physician, so can I work for you?
You were impressed, huh? I can see.
I'm joking, but I'm serious about just that what we would call that at Women in Global Health is gender transformative leadership, and I want to really acknowledge and congratulate UNFPA and Natalia and the team and all of the partners here that have made this index possible. I think it is very exciting. It's game changing. And to answer the question, the role of civil society. One is that we really can be part of changing the narrative. At Women in Global Health, we're changing the narrative that women are leaders in health. They deliver 70% of the health and care workforce, but only make up 25% of leadership roles. So we miss out on their expertise. So the health solutions that are getting designed are not the best solutions because women are at the front line. So that's an example of where civil society can change the narrative. We have an award program called Herons of Health. We've often linked up with private sector companies to bring women from all around the world that are working on some of the hardest challenges and flip the stage. So we have the policymakers, head of states, ministers, and the audience. And on stage are the women that are doing the really incredible hard work. And that's an example of how civil society partners with multilaterals, governments, and private sector to change the narrative. The second is really being joint advocates. So bringing visibility to exactly these kind of good examples, the ones that have been shared today. At Women in Global Health, we have been advocating at the highest levels at the UN, at the World Health Assembly, but what's even more exciting is that we have over 55 chapters around the world. We started in 2015. I myself was a physician in training and fed up with the fact that women deliver health, yet men lead it, and started it as what was meant to be a side project, and now being a doctor's a hobby, whereas leading Women in Global Health is the full-time gig. And now we have about 55 chapters all around the world, organic growth. Women from all different backgrounds in health are saying we are leaders and we want to be part of that change. And so being joint advocates, sharing these good practices, spreading the word, and really making sure that Sustainable Development Goals is getting that awareness at the national and subnational level. And I'd say the third part of it is really the data aspect of it. It's great to see that was mentioned by the Accenture team here and others as well. Civil society can be a key partner to make sure that you're actually looking at the right data. We often are the group that comes in and looks at the information and says, what about the women in health, women health workers? If your health workers are not supported in your society, then where your employees are going for their health services, they're not going to get the full benefits. And just to put a data point out there, one of the biggest campaigns that Women in Global Health is currently working on is making sure that all women in the health and care workforce have formal jobs and are compensated. About 1.5 trillion, and I know in a setting like this in Davos, you know exactly what that number means. Annually, women subsidize that work globally, and it's unpaid. So we're calling for, in every society, to end all forms of unpaid health and care work, and I really hope that this can be added on to the efforts of ESG, because that's what it's going to take, is our health and care workers to be also supported as part of this transformative journey.
Thanks. So Jan Willem, we've already heard a little bit about traditionally male-dominated organisations and managements. What's your reflection on what can be done to sort of push the SRH agenda, even in those sorts of organisations and sectors?
Well, in a male-dominated organization, which I'm not quite sure we're super male-dominated because we're increasing our gender equality on the top management at all levels. But one of the things that, of course, you see there is that what measures gets done. We're an engineering company, so we want to measure everything. So when we first started to work on SRHR, it was from a perspective that our portfolio was about maternal health. So maternal health, providing better maternal care, great, tick the box. But then when ICPD came along, the International Conference on Population and Development, and there was also commitments about sexual harassment and about women empowerment, we said, okay, where do we, where does this fit in? Yeah, and we were looking for frameworks to then also be able to measure that. And what was already mentioned, the ESG frameworks in the European Union are going to ask you to report on social issues. So, and what Natasha very eloquently said, most people have some policy on sexual harassment, on gender equality, on training and stuff like that. But when it comes to SRHR, it's not there. So, if it's not there, then it doesn't get done. So, and there we were looking for the tools to actually be able to say, well, if we want to embed this into our organization and make sure that all the aspects of SRHR are done, then we first need to understand it better. Then we need to embed it, and then we start measuring it. So I mean, we looked at the other way around. That's actually, is it there? If it's not there, should it be there? How do we measure that, and then implement it? At the same, so what we then did is we looked at tools out there and initiatives out there what can help us drive that implementation. One of them is the women empowerment principles. So our CEO said, who's a man, said, great, yes, I'll do that. But I want to make sure that we can measure that and we can implement it. Can we actually meet it? Do we have the programs in place to actually do that? I don't want to promise something and not deliver on it. But that unlocked a lot of initiative and empowerment within the organization. That, okay, well, now that we signed, now that we committed, we got to deliver on this. Very simple example of that is period positive workplace certification. So in the Netherlands, you can get that. It's valid for all your sites, so not only the office, make menstrual hygiene products available in the office, but also on your manufacturing floor, which is, of course, for women very difficult to actually leave the job while they're having, when they suddenly become have their menstrual period. And so if you are making that available free of charge, then you can get your certification. That was never a board discussion. It was never something that came up because it's not in the bigger policies of sexual harassment and equal opportunity in training. But it's more granular, it's more nuanced. But it's a very obvious thing to do, so we're now working on that and implementing that. And so we're at the beginning of that journey, eating away at those elements, going deeper on what does sexual reproductive health and right in the workplace mean. We also know that it means a lot in the supply chains. So we're working with Responsible Business Alliance, who are doing this, working on human rights, women empowerment principles throughout the supply chains all over the world to say, how can we embed those criteria in there? So these criteria that are being developed, what I'm hoping to see is that the ESG standards in the European Union will have an annex in there with all these ideas. Because it's not that male-dominated or women-dominated organizations don't want to, it is that they simply do not know where to start. So if you said, this is where you start in your annex, pick the ones that are most relevant for you, then I'm sure we'll see an acceleration of this within the workplace, but maybe more importantly, also in society at large. And that will probably be the biggest catalyst to have an impact on this SRHR agenda globally.
Thanks very much. We've already heard a little bit about regulatory or legislative approaches like Switzerland, but more generally, of course, Peter Paul, standards, guidance and so on exist. GRI, very important in that. So tell us a little bit about the scope that you see to drive uptake.
Excellent. Well, thank you very much, and thank you UNFPA for having us here. As a global standard setter that advocates for more corporate transparency, social part, the S of ESG is for us specifically important because we do focus on the impact that companies have. We're less interested in the financial consequence of those impacts as GRI. So we were very pleased to join this conversation. I remember sitting here last year talking about how do you measure this and should we develop a standard. We thought about, yes, we need to hold companies responsible. So the work stream on metrics was an important one. But I was also very pleased that the idea of UNFPA developing a standard was dropped relatively quickly. because standards need to be maintained, they need to be updated, they need to be rolled out. Plus, getting companies to report on yet another standard is difficult. It's much more interesting and much more effective to get the metrics that Accenture has been working on integrated in existing standards, like the GRI standards, like the European standards. And just to also throw out a number, there's over 14,000 companies already using the GRI standards. So they've invested in reporting, they've set up the systems. So adding metrics onto a system that they already have is much more compelling for a company to do than come up with something completely different. Secondly, we as GRI have been working very closely with the European Union to integrate the impact standards of the European Union, align them as much as possible with the GRI standards, again making sure that companies actually act, because they've already done this, they know this, they have the systems in place. Philips is a good example that's been working with the GRI standards for a long time, and we're adding it on because we miss stuff. So this work has been extremely important for us also as input. So the short answer is, to your question is, get it integrated in existing reporting frameworks. Now from a GRI perspective, the timing also was perfect, because we are currently updating all our labor-related standards, and this whole idea of comprehensive disclosure on access to healthcare was already on our radar as something that we needed to add to our standards. So we've been working, provided input to Accenture and the whole project, but also actually yesterday our team sent our initial thinking to UNFPA and said, well, give us input. This is where our thinking is headed. So it's really become a collaboration between the two organizations, and I think that's very interesting and very useful for women around the world to have companies think about this structurally within existing reporting requirements that they already have, and integrated it in their natural thinking annually. Now, a couple of observations specifically on the proposed metrics, if I may. One, there's this question how to deal with the difference in governments provided mandated social protection. There are huge differences around the world, and somehow you need to integrate that in your standards, in your metrics, into your reporting. So from a standard setup perspective, we would urge a little bit more work around how do you require companies to publish a gap analysis. And look at mandated coverage in the various jurisdictions the companies operate in, and then I think it's reasonable to expect that the company fills the gap in those jurisdictions where they have less requirements than in other requirements. So that's one thing. The other thing is on affordability. I'm not sure that the proposal, and thank God this is a living document and we need to work on this. I don't think it gives enough space to acknowledge that women do bear additional costs as a result of, for example, having to buy menstrual products. The term that I came across was period poverty. That's something that we need to address. And I've already heard a couple of examples of companies providing either financial support or the products themselves for their employees. So I think that's something we should think about. And last but not least, we would have to think very carefully about rating companies based on the SRHR policies. There are multiple ways of ensuring workers have access to sexual and reproductive health services, and understanding where and how this is managed within a company that can be all over the place. So just looking at one set of metrics and making that the rating system, I don't think it's good. So we need to think a little bit more about it. And last but not least, and this is maybe a little bit my personal hobby horse, financial materiality. In probably all companies, sexual health and reproductive rights are not financial material. But we need to change the perception on that, and I think this is a role for UNFPA, but at the end of the day, excluding 50% of the total workforce globally of getting meaningful work, contributing as much as they can to life and to work, that is an economic argument that needs to be had. So there is a financial materiality, it's just spread over more companies. Let me leave it at that.
Thank you. So we've heard a lot from the internal perspective of companies. We've heard a little bit, as it were, from external accountability in civil society. But of course, Marin, ESG metrics are very much there also, aren't they, to drive investor tracking and decision making. So give us a little bit of sense from 2X perspective and more generally, how useful will these be for investors?
Yeah, so how to drive investor interest? I'm afraid we came up with a new set of standards. So in 2018, the 2X Challenge was launched. It was a $3 billion challenge to get more money into the hands of women. To date, we have mobilized nearly 30 billion against the so-called 2X criteria. And it just started as a challenge on a stage. The 7 G7 development banks wanted to do something important, but it got traction around the globe, and here we had a new set of standards. We need to collaborate with all of you. And so, but the 2X criteria, what they measure, and measuring indeed is very, very important, and what they measure is where women are in the ownership, as owners of companies, as leaders of companies, in the workforce, and you spoke about that, in the supply chain, you spoke about that, and products and services developed with women in mind. And so these are the 5 very easy, simple to follow 2X criteria that investors are using around the globe. And I'll repeat, we started as a $3 billion challenge. We are nearing the $30 billion mark on the 2X challenge. And that is great, and it's not good enough. It is not good enough. We have to comfortably be able to talk trillions in order to equalize our system of finance, because that is 2X Global's mandate, equalizing our system of finance by investing in women and by getting more women in leadership. Maybe I can give one example of what does that mean, you know, products and services developed with women in mind. Financing a venture capital company that comes up with a menstrual health tracking app, so that women are informed about their menstrual cycle. When are they most productive? When are they most moody? Wouldn't it be great if you could start a management meeting and say, what day are you in your cycle? And then you know whether people are productive or not, or if it's the right conversation to have. I think we have a long way away from that. But, you know, one can always dream. I'll keep it at that.
Okay, we're almost out of time, but so again, as from the last panel, one sentence from each of you. Just, you know, we talked about a year ago and progress since then. What would be your expectation a year from now, notably perhaps around the metrics and their implementation? Marion.
Oh, one sentence. So I cannot talk about male ambassadors, about storytelling, about destigmatizing female physiology. Okay, so if I choose one, I'm cheating. I'll choose more women in leadership, because that is how we can normalize this conversation, and that is incredibly necessary to destigmatize female physiology, and it will help with productivity, with happiness, with all the things we all want at work.
Thank you. Please.
I have a very practical question, effectively, for everybody here in the room. We've received now the metrics. GRI is going to publish in the second quarter of this year a public consultation on our new set of standards. Read it, send us your input. Only then do we get better standards. And because our link with Europe, as well as with the ISSB standards, it will get further exposure.
Okay, Jan-Willem.
So to accelerate this, you need the programs that are in place right now. So there's an initiative on target gender equality, which is hosted by the UN Global Compact as one of the 5 initiatives where industry can make an impact. That's going to get extended to sexual reproductive health and rights. 1,500 companies have joined in the last 3 years. In the Netherlands, 75 companies joined in the last 3 years, but only 6 Dutch companies actually signed up to Faster Forward on gender equality. So if we're down here next year, I would say 10,000 companies in target gender equality and about 500 signing up on Faster Forward. That should give us a momentum, if you like, the tilting point to actually make this a normal new way of doing business.
That's a benchmark. Rupa.
So I've already said it, but I'm going to say it in a simpler way. Gender transformative leadership, and looking both inward and externally, as all of you are modeling this in the private sector. Also think about how you can influence that to transform the norms in the societies you're operating in, and ensuring that we no longer have any form of unpaid health and care work. And believe me, all your employees that are women are definitely doing unpaid care work. So think about that as part of the strategy too, because that's part of the bottom line. Thank you.
Thanks. Yeah.
Yeah, I'm going to go back to Sahil, and actually it's part of also the infinite wisdom of Arnold Schwarzenegger, who said that, you know, you should put up a big, audacious goal, and then you should approach that goal in very small steps every day. So every day, you know, you took a small step, however small, it was in the right direction. So, you know, if we next year can hear more companies telling us about the initiatives they have taken, I think that would be great progress, because if we try to solve the whole problem at once, we will go nowhere, I think.
Okay, I'm going to have to be ruthless because we're already out of time, but I hope that most of our panelists can stay around for the informal session a little bit afterwards so you can follow up with those questions. But do please thank them for their great contributions. And now I'm going to, for a call to action, ask Khushbakht Shah Jalani, the founder of KSG Legal and the WEF Global Shaper, to speak. Please.
First of all, thank you so much, UNFPA, the lovely Marioso, and the lovely lady over there, Bame, for inviting me over here. Hello, good afternoon, ladies and gentlemen. Assalamu alaikum. My name is Khushbakht. I am a litigator in the city of Karachi from Pakistan, and I also have a non-profit called Adal or Sehat, and I am a global shaper, currently the curator at Karachi, from the country Pakistan. Global Shapers community is a community of 10,000 young people under the age of 30 who are trying to create some sort of social impact in their own realms. My area of expertise is gender-based violence, and I have been representing women in the courts of Pakistan, before the district courts and the high courts, the women who are affected by some form of violence within their homes and their communities. I will take a moment to turn on my phone because my speech is saved here. Really don't want to miss out this opportunity because I have really less time. As a lawyer, having dealt with 50 cases concerning women in abusive marriages, having experienced marital rape, who are traumatized and are barely functioning when they come to me, I can confirm that women do not need saving. Women need love. And it's as simple as that. Despite seeing the heinous state of sexual violence being committed by their own families on these women, I can attest to the fact that they need the kind of love that is in fact lets them just be themselves. And what is love? And without really complicating it, I would just say a few lines. They need the love which lets them be. It's the kind of love that lets them live freely, and it is a love which is an experience that humanizes them. I take this opportunity as a 27-year-old to speak on behalf of young girls, minors all across the world, my sisters in Ukraine, China, Pakistan, India, and most especially Palestine. I urge here the companies and the wonderful panelists who are here, I urge those companies, all the companies here, that all you need to do is to implement some policies which are reflective of some form of love. And if that love looks like having strong anti-harassment policies, then be it. Or if that love looks like having very efficient check-ins with the women who are working with you, because there are so many things that are happening in their families. So if that loves look like doing monthly check-ins or like weekly check-ins with them, that is all that companies need to implement. And if the crux of that is that the companies just need to humanize the workers that are there, and that is going to be my call to action. Thank you so much for the platform.
Thanks very much. And now I'm going to turn over to Ian McFarland for some closing remarks.
Thank you, Andrew. Hello, everybody. I'm Ian McFarland. I'm the Director for Communication and Partnerships at UNFPA, and it's been a remarkable afternoon. Thank you so much. I'd like to do three things. One is to appreciate those who've spoken, who shared their examples. I'd like to thank those people who are behind the scenes, who've made it all possible. I'd like to thank those of you in the room, in the SDG tent, and I'll come back to the SDGs in a minute, and those of you who are online and listening and I hope being inspired. For me, I want to just quickly recap what we've heard today and set that in a bit of a context. Arriving here for the WEF at Davos, there was a sense of we need to rebuild trust. There was a sense of uncertainty about the future. If you read their global risk report, it's not a great world out there. We heard that we were falling behind on the SDGs. What I've heard today, the flip side of that, are words about hope, ending there with Kushba on love, Lorenzo's appeal to opportunity, talking about levels of ambition. I think what's been really special has been the fact that we've used facts and figures, that we've learnt about telling stories, that we've got practical with this set of indicators that we can all draw from, contribute to, and further develop, with a view to realizing not just benefits for private companies, but benefits at scale that redress those concerns of uncertainty and lack of trust and lack of information. It's a really, really powerful moment. UNFPA is really, really proud to be part of that with all of you. My last point would be to talk a little bit about the way forward. Firstly, I want to acknowledge that we didn't have time to have the Q&A. People did send in questions on the Pigeon app. We will address those questions in the way we report on this meeting and the way we take it forward in the tool that Accenture presented. If you would like more information, and you've already got a bag full of big reports, here's a simple postcard that you can find at the back that you can scan and contribute to. So 3 ways forward. Please join us in this coalition. Please contribute to the thinking around these metrics and what we can do and how we can fit them into other frameworks. And please take pride, champion, show off what you've been doing in your own companies to inspire more and more to join, to change, and ultimately to transform the world for women and girls. Thank you very much for your participation today. Thank you.
Thanks, Ian. I thought we might actually have time for just 1 or 2 questions briefly, if there's anyone in the hall. If anyone does, please feel free to raise a hand, and we'll direct it to the right person. Anything else? If not, I think hopefully we can go into informal. Did I see one? Sorry, was there one online?
There is one online.
Okay.
It's going to pop up on the screen in 3, 2, and 1.
Goodness me. Okay, well, 4 votes then. So how does the coalition plan to adopt metrics in different regions and for diverse industries? Who would like to have a go at answering that?
I can probably say a few things on that. So the idea now with the metrics and with the implementation tool is to really look at different geographies and different industrial sectors and see what is the type of tailored approach we need to have when we somehow roll out the indicators. So we will have a series of regional dialogues in the next few months, where we will present the indicators, collect the specific inputs and feedback, and so that will help us also to roll out at the regional level. I don't know if Natasha or Fanny want to add anything from...
I think it's we can maybe take, let's take that second one actually, which is really very relevant in terms of companies in different contexts and with levels of resources. Not easy. Anyone want to have a go on that? Yes, sorry. So the question is, how do we see the expectations for companies operating in rural areas of developing countries, knowing they don't have the same level of resources? Anyone want to have a go?
Sure, happy to take a stab at that. I think this goes back to one of the very first steps we talked about when it comes to diverse private sector actors, and that is understanding your current level of maturity. At no point during the conversation did we state that there is a standard of X that every organization in every geography, in every sector needs to achieve, because that is an unrealistic expectation. The goal is to figure out where you are today and to make and take measurable steps in the right direction, just like one of the brilliant panelists shared.
Okay. Oh yeah, please. You want to ask a question or answer? Please do. Yeah, it might be so.
Maybe a controversial point, but I do want to raise it anyway. Isn't that second question also a responsibility of the companies that can afford this, to help companies in developing countries deal with this?
Okay, yeah, please. Got a microphone. Yeah.
There's a camera in the back, so if you want to come here and, yes. So people online can see you.
Me too. I'm Jessie. I just wanted to. Do you want me to speak from here? Okay. Great. Hello, everyone. My name's Jessie Tolkien. I run a small firm called Drive Agency that I started 3 years ago. And I guess I actually wanted to address one of these questions of what advice do you give to a young scale-up?
Perfect.
So I spent 20 years of my career in senior positions, always working for a man, and always asking, could we have a better parental leave policy? Could we support sexual and reproductive health as part of the overall benefits? And I heard a laundry list of reasons of why we couldn't. We're too small, you don't understand the finances, do you want to take a pay cut to be able to do that? Sure, if you want to donate your salary or your bonus to make that happen. I have 13 employees. I realize to those of you in the room that have 13,000 employees or 130,000 employees, this sounds like nothing. But at my company in a country that offers no parental leave for the most part, we have 6 months paid parental leave. We support reproductive health care for people who are not able to do things like IVF, et cetera, so that everyone has access. We provide that leave to both, regardless of if you adopt, whether you're the parent giving birth or supporting. We make trade-offs, but the trade-offs we make are not the trade-offs of the well-being of our employees. And I can tell you that I've had 0 turnover in 3 years, that I have people begging to come and work at Drive Agency because we center our people. I've never worked with a group of people that work harder, that want to do more for this work, and we're building a constellation of other small firms to help show them how we do it, to do the kind of job shifting so that we can handle somebody being out of the office for 6 months and make sure that their job is there. So anyway, I just wanted to say it. I do realize I come from a very well-resourced part of the world, but I can also tell you that when we're in competitive bids to get work, we do social impact campaigning with companies and NGOs. The fact that we treat our employees this way, I think, is a competitive advantage that helps us win work over and over again. So thank you very much.
Thank you. So a great message of inspiration, even for smaller and startups. An excellent message on which to end, and we'll move now into our informal section. So do please stay and talk and network. Oh, can we have the speakers back on the stage briefly for a picture, please? Yeah.
And I work with that, but that's not my fault.
Yeah, that's fantastic stuff.